All right, so we're going to talk now about some common infections that women may experience. None of these are STIs. STIs are covered in a separate lecture. So these are some common non-sexually transmitted infections. Some of them may actually also be transmitted sexually, but they're not an STI because they're not primarily or exclusively transmitted sexually. So the first thing you need to know before we talk about infections is what is not an infection. Vaginal secretions are normal in women with normal hormone production. They vary through the menstrual cycle. A couple years ago, there was this clean panty challenge where women were encouraged to post a picture of their panties after they'd worn them all day, and they were supposed to have no secretions in them, and that meant they were a clean person. All of those were faked because that's not real. Normal vaginal secretions exist. They're usually clear to cloudy or yellowish. They're non-irritating, and they should have a mild, non-offensive odor. They're also somewhat acidic because an acidic environment maintains normal flora in the vagina. So all secretions from the vagina do not indicate infection. So sometimes the first thing we have to do is educate people about normal secretions. Okay, so one of the most common vaginal infections is bacterial vaginosis. Okay, the normal flora are replaced by an anaerobic bacteria. The patient will notice a profuse, thin, white, gray, or milky discharge. It may cause itching, and it may have a fishy odor. This can be misdiagnosed as an STI. If you're not pregnant, if a person is not pregnant, there don't seem to be a lot of other complications related to this, but it is associated with an increased risk of preterm birth. The risk factors, what things make this more likely to happen? Douching, antibiotics, and hormone changes, which are common in pregnancy. Women frequently experience this for the first time when they're pregnant. Management, prevention is better. So we want to encourage women to try to maintain healthy vaginal flora by not douching and not using harsh cleansers and things. But metronidazole is the usual treatment. Oral metronidazole is most effective, but metronidazole should not be given orally in the first trimester of pregnancy, so vaginal may be given. Someone taking metronidazole needs to be cautioned to avoid alcohol while they're taking it. It causes some really serious symptoms. So one thing that sometimes you'll see is that women get into a cycle, they notice a fishy odor, and they start douching because they think they're not clean enough. And the douche washes out all of the normal flora, and so the bacterial vaginosis gets worse, the odor gets worse, they continue to douche because they think they're not getting cleaned enough, when what they're actually doing is perpetuating the problem. So education is also a piece of this. Another common vaginal infection that women have is Candida. Yeast infections are really, really, really common. Usually this is Candida albicans. It leads to, what does it look like? Severe itching, excoriation, and swelling. So the tissue will get swollen and red and very itchy, and the skin gets very friable. And if there's discharge noted, it's white, thick, and lumpy and looks kind of like cottage cheese. The risk factors: douching again, diabetes, antibiotics, pregnancy, obesity, a diet high in refined sugars or artificial sweeteners, tight-fitting or non-absorbent clothing or underwear, and taking corticosteroids or hormones. Management, over-the-counter or prescription topical fungals or antifungal meds are usually the first line, things like Monistat. There are oral antifungals. fluconazole is frequently used, diflucan, that some women use. And women who know that they're prone to yeast infections, if, for example, they get an antibiotic prescription, often ask for a fluconazole prescription just to use afterward. Sitz baths can be used for comfort. You want to encourage them to use cool water for that. Lactobacillus may be taken orally or applied locally. There's research is inconclusive about whether that's effective, but you may hear people that are using lactobacillus either orally or locally. Garlic may be applied locally. And again, those are home or alternative remedies that don't have a lot of science to support them. So just be aware that you might see that. The first suspected yeast infection should be evaluated by a healthcare professional, because sometimes people will decide it's a yeast infection when it's really something else that needs to be treated differently. Intercourse should be avoided during treatment. They may be transmitted sexually, but this is not an STI because that yeast tends to be there anyway. It's the overgrowth that causes the problems. Tampons should be avoided during treatment, and the patient should be taught to complete the full course of treatment. Some other prevention things, decreasing sugar, drinking plenty of fluids, general hygiene, be careful not to use any harsh cleansers or anything like that. Irritated tissues are more likely to get infected. Sometimes people are advised to not wear underwear at night, things like that, to allow for better circulation, and that decreases yeast growth. The next one we're going to look at is group B strep. Group B strep is normal vaginal flora in some women who are not pregnant. So we only ever know about this because we test for it in pregnancy. If someone is colonized with group B strep and they deliver a baby, that baby has a small chance of being infected by the group B strep. But those babies that get infected can develop neonatal sepsis. So beta strep is associated with neonatal sepsis. So pregnant women are screened at 35 to 37 weeks. And if they are positive, they're treated in labor with antibiotics to prevent transmitting that to the baby. If a baby is born and the mother's group B strep status is positive or unknown in the baby, and they've not had time to be treated during labor, that baby would need to be monitored for signs of sepsis. Sorry, dry throat. Okay, toxic shock syndrome. Toxic shock syndrome has been associated with menstruation and tampons. It can actually develop in other settings or in other situations. So don't assume that someone doesn't have toxic shock because they haven't used tampons, but it is commonly associated with menstruation and tampons. It's most often due to staph. It can also be group A strep. What happens is the toxins that are produced by the bacteria cross into the bloodstream because of microabrasions, and that's why it's been associated with tampons. If a tampon is used and is not completely saturated, then the cotton can adhere to the wall of the vagina, and as that tampon is removed, it causes little microabrasions, but irritation, that just little microscopic tears. If tampons are left in place long enough, bacteria will start to grow, and the toxins produced by those bacteria actually cross into the bloodstream. So the symptoms are due to an inflammatory response to the toxin. The patient may develop fever. They have a rash that looks like sunburn. They may have muscle aches, sore throat, swelling, hypotension, vomiting, diarrhea. It can actually be fatal because it can lead to what's basically septic shock. Okay, toxic shock syndrome. They're having an inflammatory response to the toxins rather than to the actual bacteria that's not in their bloodstream. Prevention, we want to teach women to always wash their hands before inserting a tampon. Use only clean tampons that are newly opened. So if one gets open, it's got to be tossed if it's not going to be used right then. Avoid trauma with the insertion. We want to teach them to insert the tampon carefully and gently, not be too rough. Change every 3 to 6 hours. Avoid using super absorbent tampons. Don't use tampons at night. Don't use tampons postpartum after having a baby, after a miscarriage or an abortion. And if anyone has ever had toxic shock syndrome, they should never use tampons again because they're at greater risk. Okay. The last infection I want to mention, you already know a lot of the prevention and treatment for this, but I want to mention UTIs. Women are more prone to UTI because the urethra is shorter, and we're more prone to pelvic floor dysfunction. So we're more likely to have some urine pooling in the bladder. So there are several things that put women at greater risk for UTI. So UTI prevention, plenty of fluids, limit sugar, hygiene, wipe front to back, things like that. UTI treatment, UTIs need to be, usually we need to get a culture and sensitivity, treat with the appropriate antibiotic, and then make sure they take the full course of treatment. Don't save some for later. Okay, in the next recording, we're going to talk about some benign breast problems. We won't get much into breast cancer. We will talk about some risk factors, but the next recording is going to be about breast issues.